Okay, I'm going to do an ultrasound fat melting treatment on my patient. She complains about the unwanted excess fat in this area. So first of all, we will start by taking photographs and measurements of the area, which my assistant will now do for me, and I'll just mark the areas we're going to treat. Now, with glove handles, it's a very nice area to start with because when we treat this area, first of all, it tends to be quite soft fat. So we will break the fat down and the patient will see the result visibly in one session. And then because of the area that we have, we can actually compare it to the other side after, and the patient will visibly again see the difference. Now, with ultrasound fat melting, what we would... Actually, let me start again from the measurement part. Okay, so we'll usually do around 4 measurements for this area when we do the whole stomach, the whole torso, but we're just going to concentrate now from here to here. So we'll take 3 measurements. We mark where we have gone across so that we're very specific when we come back to measure, and the patients usually see around 2 to 5 centimetres reduction in one session. Now, many people ask how this happens. Well, the cavitational phenomena is that when we go over the area where there is fat, we're able to break down the fat cell, which will start off as a round, hard cell, and by the time we finish, the ultrasound is able to break down the fat cell into a free fatty acid. This is then absorbed by the body and eliminated in the normal, natural, physiological way. The patient will optimise their results if they go on a low-fat diet, drink lots of water, and also exercise. Once we've melted the fat down, the fat will, as I mentioned, be absorbed by the body. Some of it is used up as energy, and the rest will go to the liver, where it will be wait to be expelled. So, if the patient has a bad diet and they're taking in more fats, then the body won't be able to differentiate between what I've mechanically broken down and what the patient is eating, and therefore some of the leftover fats will get reabsorbed into the body. Usually we require between 3 to 5 sessions. For this type of case, usually 3 sessions, but if we wanted to do the full trunk and the top of the back, then 5 sessions is usually required. There's no downtime with this procedure. The patient can come in their lunchtime and they can go back to work immediately. There's no problem. The only thing they really need to do is watch what they're eating, and again drink lots of water and try to exercise in between the sessions. There's no pain with the treatment procedure. The patient will feel maybe like a pins and needles sensation within the area, and also they'll hear like a funny sound in their ears, and this is the ultrasound waves passing through the body. Okay, we'll apply the ultrasound gel. This allows the ultrasound to be absorbed. The treatment procedure usually takes around an hour. Any more than this is not very safe for the patient because we don't want to overload the liver. So we'll divide the area, so we can do 20 minutes, 10, 10 for this particular area, and we will see visible results once we're finished. Now all we need to do is focus the ultrasound to the fat. What's excellent about the ultrasound treatment is it's not absorbed by any of the other skin tissue, so it's very, very safe. It's only absorbed by the fat cells, which is important when we're treating. And basically we'll keep doing this, we'll keep working the area until we can feel the fat start to break down. Okay, Now we've just treated one side with the cavitation. As you can see, there is no marks, but you can visibly see that this side has now reduced from this side. You just stand up straight for me. So again, now we will treat this side to make it equal, but you can actually see the volume reduction. Once we finish this side, we'll take the measurements again and then we'll let you know the result.